Hello, it's so nice to meet you. Are you here for an ear, nose, and throat exam? Very good. Well, I'm the doctor who will be taking care of you today. So you can have a seat right there. And I'm just going to ask you a few intake questions before we get started. So let me see here. And this is your first time in our practice, correct? Okay. Alright, so your first and last name, please. Okay, and your phone number? Perfect. And I believe that the front desk asked you all of the other insurance questions, correct? Very good. Okay, so why are you here specifically? Are you just here for a checkup, or are you experiencing an issue? Okay. So just a checkup. And have you ever had an ear, nose, and throat exam before? Not all at once. Okay. Okay. Any medical issues currently or within the past year? Okay. And when did that happen? And then what about any medical issues that run in your family? Very good. Okay. Do you smoke or drink? Okay. And how often? Very good. Now, in regards to your hearing, have you had any issues recently? That could be popping or an ear infection, or any kind of crackling sounds. Okay, good. What about any dizziness or headaches? And how often do you have them? Okay. Let's see. Any breathing issues or any sinus pain recently, or any loss of smell? Okay. And when was that? Okay, what about, do you have any allergies? Very good. Okay, and then in regards to your throat, any issues that I should be aware of? Maybe a sore throat, any loss of taste? Okay. And then also, do you have your tonsils? Okay. So I'll be starting with your ear exam first. Then I'll move on to a nasal examination and then a throat examination. So do you have any questions before we get started? Okay. And are you feeling comfortable, relaxed? Good. Well, if you need anything during the exam or need to get up, just let me know. We're going to start off by just listening to your lungs, your heart, and then also checking your blood pressure. Okay? Okay. So, like like I just said, I'm going to listen to your heartbeat. So can you just lift your shirt for me a little bit? Very good. And when I ask you to take a deep breath in, please just do that for me, okay? Okay, so here we go. Alright, deep breath in. Very good. And another one. Okay, and then just one more deep breath. Perfect. Very good. Everything sounds exactly as it should. So, no concerns there. Now I'm just going to get my blood pressure supplies. So, let me see. And when's the last time you had your blood pressure checked? So it's been quite a while. Okay, so can you just give me your arm, please? And just slide it right in there. Very good. Okay, is that too tight? No. Good. Okay, just catch this. Okay, perfect. Now this is going to be tight for a few seconds, so just relax. Very good. Perfect. Wonderful. Well, your blood pressure is perfect, so no concerns there. This away. And then we will move on to your ear exam. Okay, so I'm actually first just going to inspect the insides of your ear canals. And since you haven't been to an ear doctor for a while now, I just want to make sure there isn't any buildup or anything that would be a cause for concern. So I'm just going to use my cotton swab here and my flashlight. So first, can you just look in that direction for me? Very good. And I'm just going to take a look inside your ear. Very good. And no pain in your ears, correct? Okay. Okay. Yeah, this one looks good. Now let me see your other ear. So turn your head the other way. Very good. And let me just take a look. I don't see that they need clean today, so I'm just gently looking inside. Very good. So definitely no concerns with your ears. So I'm just going to make note of that. First thing I'm going to do is just whisper some numbers on both sides of your head. And I just want you to repeat the numbers back to me. Okay? So you can just relax, close your eyes if you want. Okay. 1, 3, 55. Very good. 7, 22, 31. Good. 91, And you didn't struggle hearing any of those numbers? Okay, and same on both sides? Alright, so now I'm just going to use my tuning fork for a few tests. So really all this does is assess hearing loss. So the first thing I'm going to do is just strike it, and you're going to tell me when you hear it, and raise your hand to tell me which side it's on. So you have to close your eyes for me. Very good. So I'm just going to strike it like I said, and just let me know by raising your hand. Okay? Okay. Very good. Yes, very good. Perfect. Oops. Very good. Now, did one side sound louder than the other, or did they sound the same? The same? Okay. Next, I'm going to do what's called a Weber examination, and this is again using the tuning fork. So what I'll do is just strike it and actually put it right in the middle of your forehead, and you're going to tell me if you hear the sound on both sides or just on one. And here we go. So did you hear it on one side, both sides? Both sides, and you would say that that was an equal sound? Good. Good. So if you were to tell me that it wasn't an equal sound, that's where there would be a concern. So good to hear. So for this one, I'm going to strike it, and I'm going to ask you which sounds louder, number 1 or number 2. Alright? So you can just close your eyes. Very good. And just relax. Number 1 or number 2. Do it again. Number 1 or number 2. Okay, I'm going to do this side. Number 1 or number 2. And one more time. Number 1 or number 2. Okay, very good. So I am not detecting any hearing issues, which is very good. So now it's time for your throat exam. And you said that you haven't been having any issues, you haven't had strep throat recently, nothing at all? Okay. So the first thing I'm going to do is just actually palpate the area around your neck and your throat. So is it okay if I touch your face? Alright. I'm just going to put some hand sanitizer on first. Alright. And then I'm going to inspect your teeth, your tongue, your palate, and your tonsils. Alright, so just stay still for a moment. I'm just going to feel your neck area. Are you feeling any pain when I do this? No. pain? Okay. Very good. Okay. Very good. Okay. Now, I'm just going to take a look inside your mouth, so please just open your mouth for me. And let me just take a look. Very good. Just look at your throat first. Can you say ah for me? Very good. Okay, no signs of redness. I don't see any swollen areas. So that's good. And let me just look at your teeth. Okay. Very good. And your tonsils look perfect too. Again, no redness. It looks good. And your tongue also looks good as well. Can you just lift your tongue up for me? I'm going to check the bottom. Okay. That looks good. Okay, and let me just check your neck one more time. Yeah. Yeah, I don't feel any enlarged lymph nodes. And no discomfort, right? Okay, good. Okay. So, similar to what I've been doing, I'm first just going to take a look at your nose and make sure there's nothing out of the norm. So if you could just lift your head up a little bit for me. Yep, just put it back. Perfect. I'm gonna look. Very good. Just stay still for me. Just like that. Okay. Don't see anything on this nostril. Everything looks good. Have you had any pain in your nose? No. Good. Okay. Alright, I'm going to look on the other side. Okay, just stay still for me. Just see. No pain. I do see a little bit of red in this nostril. So, were you blowing your nose recently? Yeah, that might be why. Okay, but other than that, they look fine. Exactly as they should. Alright. I'm just going to check for tenderness in your nose area and up on your forehead. I'm going to put some pressure. Any discomfort when I do that? No? Okay. And do you typically breathe through your nose or through your mouth? Your nose. Okay. So now I'm just going to touch your face again, if that's okay. So I'm just going to press on one side of your nose, and then I'm going to ask you to breathe in and out through your other nostril, just to make sure there's no obstructions or any concerns with that, okay? So I'm going to first hold this side. Alright, and that doesn't hurt, right? Okay. So breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay. Did you have any difficulty? No? Okay. So now let's do this side. Okay, Okay? Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Any concerns? No? Okay. And no stuffiness, nothing like that? Wonderful. Well, you have been an easy patient today, that's for sure. I will say it's always good to come in for checkups. Even if you're not having any symptoms, it's better to be safe than sorry. Okay. So, I did not see any issues with your hearing, your breathing, or your throat. Everything looks fine. Just gonna make sure I checked everything I wanted to. Did the hearing test, checked your throat, and checked your nose, your breathing. Okay, everything is good. So, that being said, I don't need to see you anytime soon. So, you can feel free to come back the next time you would like a checkup. Or, of course, if you have any symptoms with your ears, nose, or throat. Okay? So, things like that could be any kind of sore throat or tenderness in your throat, ringing in your ears, or any difficulty hearing, or with your nose, obviously any difficulty breathing, or anything that has to do with trauma in any of those areas. You would definitely want to come back and see me. Okay? So you are good to go. And if you need anything, you know how to reach me. Okay? Well, it was so nice meeting you. Take care, and I hope to see you soon.